All right, Dr. Lerner, I am recording now. And so what is your reaction to the FDA's emergency authorization of the Johnson & Johnson vaccine?
I'm very pleased. It's an excellent vaccine. It has a wonderful game-changing benefit, which is that it can be distributed in a refrigerator rather than in a very cold freezer or an ultra cold freezer, the temperature of dry ice.
Right. Like the
So
Pfizer one, right?
Yeah, it is much more readily transportable. The results are superb when it comes to prevention of death and hospitalization. The numbers of efficacy that you see are meaningless because they were obtained in studies that were done dominantly in Brazil and South Africa, which have the resistant strains. And the Pfizer and the Moderna vaccine were not tested against these groups. So there is no way to compare the two vaccines in terms of efficacy. The key issue is the 100% protection, as far as we can tell, or near 100% protection against hospitalization and death. And those are the two biggies.
So it sounds like you're saying this is a game changer, Dr. Lerner.
It is a game changer because for rural areas, you don't have a freezer at minus 70 degrees centigrade. And it's stable in a refrigerator for 3 months. So it can go out to small towns. It can go out to doctors' offices. It can go almost anywhere. That makes it a game changer. And the key to vaccines is getting so many people immunized that there are so few newer infections that new mutations are suppressed.
So it's a game changer in the sense that it doesn't require the freezer. Also, it's the one dose, right, Dr. Lerner?
The single dose is helpful. That's not the critical issue.
Okay.
It's the refrigerator that's the issue. And it's a third vaccine, which is transportable much more readily than the other vaccines.
So because it doesn't need the freezer, does that mean it won't spoil as easily?
That means it's stable for 3 months in a refrigerator.
Stable for 3 months. You also mentioned that it won't. Will you further explain the variant of the other? You mentioned it in the first answer that it could also protect against the other variants.
Okay. Viruses mutate every time they divide and replicate and reproduce. That's normal. We have seen a number of variants, mainly in South Africa and in Brazil, that are less responsive to the vaccines that we currently have available. The Moderna and the Pfizer vaccine were tested against the original strains. The Johnson & Johnson vaccine was mainly tested against these new variants. Most of the people who got the experimental vaccine had the new strain. So one would expect that it would be less effective if the Moderna and Pfizer vaccine had been tested against the new strains. I would expect their results would be comparable. The key issue is not that. The key issue is how many deaths are prevented, how many hospitalizations are prevented. And the number is 100%. So my word is the first vaccine you have available is the one you should get. It doesn't make any difference whatsoever.
So this is certainly good news. And I think they're saying that it's available Monday, right? So that's pretty quick too.
Probably will be available Monday. There is a meeting, I think today, of the ACIP, which is the organization which decides how vaccines are administered. And that will make specific recommendations about how to administer this vaccine. The FDA's charge is to decide whether or not it's acceptable for utilization. They've said yes. Now the committee meets to decide how to use it.
Okay. What's on the horizon? Does this open up other doors for other vaccines to roll out quicker?
We've entered an entirely new era with these mRNA vaccines. In the old days, and I'm thinking back to think about polio. The man who discovered the ability to grow the polio virus got his Nobel Prize decades after it should have been involved. It was a dozen years before Jonas Salk was able to develop a vaccine, and it took him years to get it approved before it was actually utilized. And I remember polio epidemics when my mother was absolutely petrified if I had a snivelly nose in the summertime. And so was every other mother. Today, we have technology which has been used for 10 years, which is proven and solid and allows for very rapid vaccine development. In fact, Pfizer and Moderna have currently created new vaccines specifically for the new variants and submitted the information to the vaccines to the government for testing for antibody production. We no longer require these massive tests of 30 to 60,000 people to see how effective it is. We now use as a gold standard, do you develop sufficient levels of antibody? And that's what the government is going to be testing, so that the boosters that Pfizer and Moderna are talking about potentially down the road will be boosters against these new variants. And this is a game changer, not only for COVID, but for all infections, because it changes the technology. We don't have to grow this virus in chicken eggs like we do flu vaccine. We don't have to grow this virus in vats and try and inactivate it and hope that we got it all. We can deal with the genetic material that controls the production of viral proteins and makes antibodies in people to the viral proteins. It sidesteps all the previous stuff that we've done before. And that's a game changer.
That is so cool. I think I'm going to call you Monday and do this story in a little bit more in depth. Tonight is just a little snippet, but
sure.
Monday, if you don't mind, I'm going to call you. Thank you so much for your time, Dr. Lerner. I'm going to bother you Monday again to go into this a little bit more in depth. I'm in
lockdown. So
Dr. Lerner, what's your exact title? I keep saying that you're
I'm a recently retired infectious disease practitioner in San Antonio. I'm part of the what do they call them, the faculty at the medical school in San Antonio. It's not I'm blocking the word now.
Clinical professor?
It used to be called clinical professor, but now it's called something else. And I'm on the committee for infectious disease for the Texas Medical Association. And I'm on the COVID-19 task force.
Okay. We'll still say that. We've been calling you
that.
That's
what they identify me as.
Okay. I didn't know that changed. Okay.
From the TMA and on the COVID-19 task force.
Okay, sir. Thank you. Sorry to disturb your home life, Mrs. Lerner back there.
Not a problem. I am locked down. Every day is Blur's day.
Okay. You're going to be on our 10 o'clock news. Thank you, guys. Appreciate your time.
We'll give you a little tip.
Okay.
Something that's not available yet. Probably within the next week, the CDC will come out with recommendations about how people can meet with groups of people who are previously immunized.
Oh, how to meet.
That will be big time.
Yeah, we've been
So
waiting on that.
keep your nose to the grindstone, look for it. And I'll be happy to comment on it when it comes out, once I have a chance to review what their real words are.
Okay, will do. I'll call you for that too. Thanks, Dr. Lerner.
No problem. Okay.
Have a good night.
Bye-bye. Good
Bye.
night.